Hey, all, welcome back to another episode. I'm so excited to have you here today. One of my friends, Dr. Leslie Taylor, is going to be joining us here, and she is a physical therapist and an amazing human. Absolutely has a love for animals and dogs and just being outside and all the healthy lifestyle things. And she's going to provide us with all kinds of helpful information as far as why we creak and crack and pop and how to kind of help us feel better and understand how our body's actually put together and is working. So, very excited to have her on and help both you and I learn more about what makes us all tick. All right, guys, this is my girl, Leslie. She's pretty awesome. I already gave you a little bit of an intro on her, but I'd love to have her introduce herself. Then we can kind of go into all the things PT.
All right. Hi. Thank you so much for having me, Nikki. I'm excited to be here with you. So, my name is Leslie Taylor. I have about 11 years of experience as a physical therapist. Most of my time has been spent in Montana, moved to St. Louis, and just opened up my own physical therapy practice in St. Louis, where I'm taking a change from healthcare based physical therapy to cash based, just from my personal experience working in healthcare uh, when insurance is the middleman, and then also a large healthcare corporation is who you are employed by, it doesn't always benefit the patient. And so I really wanted to get away from that model into a model that actually really does benefit the patient. And it's about the patient, not about insurance, not about what healthcare wants. And so that's where I'm at now.
Awesome, awesome. So I guess what made you get into physical therapy in the first place?
So I had had physical therapy a couple of times like as a teenager. And so I wanted to become a physical therapist because I had always wanted to be in the healthcare field, but I also wanted to like have a life outside of my career. And so like I see doctors who work nights and weekends and things like that, and I just knew physical therapy afforded more of a like a 9 to 5 schedule in that sense.
Oh, okay. Yeah, that makes total sense. I think that, when we choose professions like that, it definitely comes from a positive experience, from our past a lot of the time too. So that's like really, really helpful. Um, so I guess I'm just curious, like physical therapy, what does it take to like become a PT? How long do you have to go to school? Is there any sort of like a residency kind of thing like that or any of those things?
Yeah, so for physical therapy school, you have your 4-year undergraduate degree. And then in 2007, which I graduated in 2013, but in 2007, anybody who became a physical therapist had to graduate with a doctorate degree. So there are still PTs out there who have master's degrees, but most of your physical therapists are going to have a doctorate degree. So that was another 3 full years of school beyond that. And during that 3 years of your doctorate program, you do internships. And so that would essentially be like your residency type of opportunities during getting that degree.
My gosh, that is so cool. So did you get that in Montana then too?
No, so I did my undergrad in Montana, and then I actually did my graduate degree in Kansas City, Missouri.
Oh, okay. I didn't realize that. That's awesome. Okay. So, I don't know. I thought that that was super interesting. I just wanted to ask because I never asked you that before. So
Yeah.
obviously with PT and with things, I feel like a lot of people are always surprised. The different types of movements that we need to do in order to improve one thing or another. And I think that maybe it'd be helpful to start with what are maybe the most common issues you see clients struggle with? What would people come to you for to help with most of the time?
So, I mean, I think I'm going to go based off of like the traditional healthcare system, which a lot of us I think are going to start there. Is like maybe you went and saw your doctor, or you saw even like it could be a chiropractor and they referred you. I would say your general population that's coming to a physical therapist is coming because of some sort of pain. Obviously, you're going to have people who have injuries, and that's self-explanatory. Had an injury coming to physical therapy because of that. But a lot of times, people refer to physical therapy because of pain, because their doctor or whoever just really doesn't know what to do with them beyond that. Now, I would say, for most of the people that you work with, Nikki, people are in the fitness industry. And so it could be pain related to like let's say squatting or burpees or, whatever, something like that. I would say that's a lot more rare in a physical therapy setting, than what we would hope for. And so a lot of times it's going to be pain that people have because they are, honestly, because they're inactive. Like that's what it
Oh,
comes down to, is maybe you're trying to get more active, and it's truly just pain because you aren't moving.
I did not expect that. Obviously, I knew that, but I wasn't even thinking about that. I'm like, and as you know, I'm so into fitness industry, and a lot of the people that I follow are fitness, and a lot of people that follow me are into fitness. I forget that there's this whole other sector of the world that doesn't move enough, right? And to get pain because
Right.
you're inactive, it makes so much sense. So is that often, I'm going to bet, like back pain, like a neck pain a lot because everybody's hunched over, or what do you think?
I mean, back pain, neck pain, shoulder pain, knee pain, hip pain. I mean, it honestly, I would say it's more so a lot of times like joint based, right? Because if we're not moving a joint, there's the synovial fluid in the joint, and so you're not lubricating the joint. And
Hmm.
so I see a lot of that, but then people don't want to move because they're in pain. And so it's that to me, it's the train of thought of like, okay, well, you're in pain at rest. You're going to be in pain as you move. It's going to be better for us to push through that pain as you move, because then you won't have pain at rest down the road. But a lot of people aren't willing to push through the pain.
That makes total sense, which is only going to add more ailments as they go along, I'm sure. Um, so what are like, say we're our active people, because that's mostly the people that are going to be listening to this. So active people, I know that most often if I am going to the physical therapist for some sort of pain, it is like my back. It's almost always my back. But I am just sort of curious, like, so for somebody that comes in, and they always have some sort of back pain, what is like the best action steps these kinds of people can take? Like active people that have pain, what's maybe some active steps they can take, or is that too general of a question?
Yeah, I mean, so it's hard. What I've always said is like, I can't give someone specific exercises unless I've evaluated them. But ultimately, like for someone like you, if you've had back pain, and let's say this is maybe your second time coming into me, because I know for you, like you've been doing, pelvic floor therapy, those kinds of things. Like, let's say it's the second time you're coming back to see me. My first question is going to be like, hey, how are you doing with those exercises that I gave you from last time? And the number one thing that people always are going to say is, I haven't been doing them. And so, what I would say a lot of times in that active population, and I can even relate for myself because, I know this doesn't necessarily relate to physical therapy, but like I've gone through my own weight loss journey where I got a lot stronger in that weight loss journey because I was very specific with exercises. Well, I had a lot of pain when I was more overweight. Well, as I was consistent with exercises, I became more stable because I was consistent. And that's what I would say for a lot of people in that active population is, it's like, hey, like, are you going to CrossFit 2 days a week? And on those 2 days a week, it's completely different exercises every single time. Well, then in the course of like a month, right? Let's say 8 sessions, I haven't even worked the same muscle group in that time frame. And so we're not going to be able to build strength and stability for, let's say, your back if we're just doing these random exercises all of the time.
Okay.
And so that's where it's going to be something where, hey, like when a physical therapist prescribes, like, let's say back exercises 3 times a week. Unfortunately, when you discharge from physical therapy, you might be able to advance to higher level exercises, but you still have to be consistent with those exercises to keep that issue away.
Totally makes sense. So obviously, like you said, it's hard to tell someone to go and do something when you haven't physically evaluated them. But really, the best suggestion is go see a physical therapist at least once and figure out what exercises you should be doing and purely just be consistent with doing them. Right.
Right. Yeah.
Totally makes
And
sense.
I would say too, like, I want to hit on that as far as like with active, like people, is that it's really hard to find and I'm just being honest, because I'm always gonna be honest, it's really hard to find a physical therapist in the healthcare system who's going to understand someone who's active. So you want to do your research and see if you can find a physical therapist who they themselves are active. Are they maybe even doing the same type of exercise you're doing so that they would understand where you're coming from? Because and the reason I bring this up is because I worked in the same healthcare system for 10 years. We would have orthopedic doctors who would tell people like, "Well, you're 40, you should stop squatting." And then they come to me and I'm like, are you kidding me? Like, I want you to be able to stay squatting because if you think about when you sit down in a chair, when you go to stand up, you're doing a squat. Why would we tell someone because it's causing them pain to stop doing that? And so that would just be my like big thing is like you've got to find a physical therapist who's going to understand movement and not just the general population who if someone doesn't want to do a squat and their doctor has no other options for them, they're like, "Well, go see physical therapy because you're already on 5 different medications for this issue."
Hmm.
So,
Oh my God, it makes so much sense. So I don't know if you know this about me or not, but we're gonna go trip down memory lane because I think it's just really important to hit home on the consistency piece too, and to find a physical therapist that understands you are an active person that's trying to just like improve strength and improve just overall health and lifestyle. So a few years ago, gosh, 2020, 2021, 2021, whatever. I did something terribly stupid at the gym and I got bone spurs in my spine. And I had like all kinds of just like
um,
numbness and twitching. And I went to a physical therapist for months and he was wonderful. We ultimately had to get cortisone shots in my spine just because I could not get the nerves to calm down. But we did everything. And he gave me the exercises to stretch out like that area in my back every single day. And to this day, I still warm up every single day with those same stretches because it was so ingrained in my head. So I think that's just something to hit home with. Like if it's a PT stretch and or an exercise, right? Make it part of your warm up or your cool down routine because when it is so ingrained in your habits, then you're going to do it without thinking and you're going to naturally be taking care of that ailment without having to think about it. Like what are your thoughts on that? Would you agree?
yeah, absolutely. And I mean, this will probably go into one of our other questions that we're going to go over, but one of the things that I'm having one of my patients do right now is I'm like, every time before you like do a CrossFit, if you see that it's going to have this specific move, like that causes your pain, I need you to do this stretch prior to. And I'm
Mhm.
like, just give me 2 minutes. Like that's all I want is I want you to do this stretch for 2 minutes before. Well, she incorporated that into her program and she now has been able to do something, a movement she hasn't been able to do since 2019. It's
Mhm.
2024. That's 5 years by her just doing this stretch and being able to now be able to do that movement without pain, which is
Absolutely.
mind blowing.
It's so mind blowing. And being able to like stay on top of that type of maintenance after it's fixed or improving just keeps it going. I mean, I,
Hmm.
I am going to pelvic floor PT. That's completely different than going to a PT for pain. But otherwise, I haven't had to go to physical therapy for pain from an injury in years. I visit the chiropractor maybe twice a year to like, align me back up. But aside from that, there's not like this consistent nagging pain anywhere because when you incorporate the things that you learn when you go to these PT sessions and you keep them going, then you're going to continue doing the maintenance that's needed in order to prevent going back again, which is, of course, unfortunate for you.
Right.
Like you love your clients, but you don't really want them to have to come back. But then again, you kind of need them to. So there's that. Um, Okay, so something that I found extremely interesting because before when I was going to that PT, I did not have my NASM certification yet. I was starting to work on it, but something that I learned when I was there is that how the muscles work in opposites from each other. So when my back and my neck were all sorts of out of place and I had all of the issues, he actually had to do needling and stuff in my chest to help reduce the pain in my back. And could you explain it? Because I tried to explain muscle imbalances and overactive and underactive and knots and how they pull different. Do you have a good way of explaining how all of that works?
Um, I mean, I would say so as far as like I'm gonna go on a little bit of a different example rather
Okay.
than like um your back to like your chest. So like for example, like let's say that you are having elbow pain, right? And it really feels like it is specific in your elbow itself.
Mhm.
Well, if we can't find anything at the elbow, right, you're going to look above and below, right? So we'll use the elbow as an example of like, hey, you're having pain when you're doing a push up in the elbow. Well, what we have to look at is what is your wrist mobility, right? Because if you don't have enough motion in your wrist, it's going to have to make up for it in the chain. So let's say that you don't have enough wrist mobility. Well, now we know that your elbow is overworking, right? It actually has to bend more. But then we also are going to look above it at the shoulder, and how is the shoulder moving, and how are the muscles there, how are your shoulder blades moving, right? And so that would be the same sense in the low back is, hey, if we have more mobility in the low back, then we probably have less mobility in the mid back, that thoracic spine. And so it's always going to be something where sometimes the pain is in the elbow,
Mhm.
but we do need to look above and below to see if there are any range of motion or strength deficits at the joint lines above or below.
Yes, I love okay, you explain it so much better than I did because like trying to understand that basically everything's connected, right? Like you can be having pain in one place, but there's something else in the line of events that could be causing said pain that you would never anticipate to be the case. I just find it so amazing. I also know, and we're going to talk about the different types of methods here in a minute that you can use to help with PT and such, other than just exercises and stretches. But I know that when he used to do dry needling on me, he'd find that one knot and it would just like pulse as soon as he put the needle in there, but then like everything else would just release. It was such a weird feeling. It was like it almost liquefied the knot itself. So I just think it's so interesting to know that um your whole body is just connected through all different kinds of nerves and muscles and tendons and all the things all connected together. And so your pain may reside in one spot, but that may not be the actual point of issue. So with that being the case, I just think it's really helpful if people understand that. Um, yes. I don't know. Do you have anything else to add for that? I'm just kind of babbling.
You're good. Yeah, I mean, I think it's just one of those things where like, hey, like if we have a knee injury and like we blew out our ACL, like we'll just use that. We know the issue is the knee, right?
Mhm.
Um, but when we don't have the specific injury, a lot of times, which is a lot of times what people come to is like, we don't know what specifically caused it. I just started having some discomfort. It may not necessarily be where you feel the pain.
Mhm.
So,
Yeah, for sure. For
so find a
sure.
physical therapist who will look above and below.
Absolutely. Absolutely. I think another big thing, and I didn't include this earlier, but I think another big thing that you can probably, touch on as well or give your opinion on is there's a difference between having like muscle soreness and muscle struggle and then pain. I feel like the easiest way to differentiate, like for instance, like my left shoulder always gives me pain whenever I'm doing like Arnold presses. Like I know there's something screwed up in there, so I know that that movement's going to bug me. But the way that I know that it's pain is because I have two shoulders and I do the same thing on this side and there's not that pain there. So I know that this is screwed up, right? But how would you differentiate to someone like, is it muscle soreness? Or am I doing something wrong and there's an issue that needs to be fixed? Do you have a good way to kind of put that or to help people understand?
So that's going to be person to person. So what I found in years of physical therapy is that like even though you and I are in the fitness space, you're still like you probably have a lot of clients who probably are not in tune with their body. And I'm not saying that to be offensive, but it's just the truth. Like
Mhm.
people just really don't know their bodies well. And so that becomes a really hard like black it's not black and white because I don't know what muscle soreness is compared to the next person. Um my professional opinion on it and years of seeing people is that there's some people out there who really just don't know what a hard workout is
True.
and have never done a hard workout in their life. And so they're just not going to be able to differentiate between pain versus muscle soreness because they just have never pushed themselves to that point of fatigue. And so versus someone like you who knows that there's something wrong and you're just not going to, do that. So my best words of encouragement to people would be is that, let's say, for example, when you do an overhead press and you do it with 2 dumbbells, it doesn't feel great. Well, let's try it with a barbell. And does it feel better with a barbell? Okay. You prefer it with the barbell. Well, it might be because you don't have enough stability and it does cause some pain or discomfort because you aren't strong enough at this point to do it with 2 different weights rather than, the barbell itself. And so like that's one example. And so that's where I would always tell people is like, hey, there may be some movements that just aren't good for you, but then there usually are ways that we can modify it and you can go from, eliminating gravity, which is just positional changes, to changing it where you're using the barbell versus a band versus a PVC pipe, so so there's not a clear answer to that.
Yeah, no, but I think that's all super helpful. Like understanding that you can try it different ways and with different weights and see does the pain go away? Does it persist? Is it the movement itself? Do you do it at body weight? Do you still have that pain? Like there's a lot of different ways that you can look at it. So I think that that's really helpful. I know the
Yeah.
first time when I was going this is like the next question. Sorry. When I was going down to that PT, I had no idea that there's more to physical therapy than like the little bands that you bring home and stretches and exercises and stuff, right? And all of a sudden he starts talking about dry needling and cupping and scraping, and this was a whole new world to me. Do you do those methods as well?
Oh yeah.
Yeah. Okay.
Yeah.
So
And that's my big preference.
which one?
All 3 of them. Like it's my preference to do like the hands-on manual therapy stuff.
Yeah, yeah, no, definitely. Because I definitely had some really great results from using them, as uncomfortable as they may have been. I think it'd be helpful though, because if people are afraid, they don't know what they're going to walk into. Can you explain what the different methods are and how they work so that people can be less nervous about them? I know like dry needling will scare the crap out of some people, but it's so beneficial. So I don't know if you want to take a second to just like explain
Mhm.
what they are and how they work.
Yeah. So any of your manual therapy techniques are really going to be working on, and I like to say your layer system. So you've got your skin, you've got then what's called fascia, and then you have muscle. And so fascia is like what's on a chicken breast before you cook it, like that white filmy stuff. And so we have the exact same thing encapsulating our muscles. And so a lot of times we are going to get, they're called fascial adhesions built up in that fascia. And it's just simply use. Like it's not like you did anything wrong. Sometimes it's like the overuse stuff, right? But it's just a natural thing for that body to build up fascial adhesions. So things like kinesiology tape, scraping, cupping, more of the superficial stuff, that is going to be lifting that skin and fascia away up from the muscle so that it can glide better. So obviously those are varying things. Like I love kinesiology tape. It can be very, very helpful for getting some of that movement back. And then also that's, I would say, the least invasive technique. Scraping and cupping are going to be the next level where, and it also depends. Like I don't think, the research that I've seen that has come out more recently is that scraping doesn't have to be to the point where it causes pain. Back 10, 15 years ago, I mean, people were causing like bleeding by scraping so hard, and you should not be at a therapist or a chiropractor or someone who does that. The research shows you don't have to go that deep. And then cupping is an interesting one because a lot of people like the war wounds of like the deep purple bruises, but same thing there. You don't need to go like that intense to have the effects. And so, yes, you're going to see people who come out with those bruises, but I will typically not try to bruise my patients if I can. Um, so those would be those 3. Then your next level, which is going to be really my favorite method, is dry needling. And so dry needling is taking a microfilament needle, which means that it is a solid needle. It's really, really small. And what we're going to be targeting is a trigger point in the muscle. Okay. And so what a trigger point is it's going to be a buildup of lactic acid and a bunch of other chemicals. And a lot of times in the muscle itself, instead of the muscle fibers being aligned in that trigger point, they're going to be mismatched. And so when we can actually stick that needle into the trigger point, what we're doing is we're disrupting those muscle fibers so that they can realign. And then a trigger point is like a cluster of grapes. So you're going to have like the center trigger point, and then you're going to have smaller trigger points that like go away from it. If we can disrupt that one trigger point, what happens is it allows your body to release those chemicals and actually process it. And so like anybody who's listening to this or watching to it right now, like, okay, find a trigger point. Like you could probably find one in your upper trap right now. So one of my favorite places to dry needle. And what happens is we shrug our shoulders or we slouch, we're just using that over and over again. And so we're going to get trigger points in those areas. And so the body just has a really hard time with that repetitiveness of eliminating that because we're just doing the same thing over and over and over again, right? And so dry needling is probably, in my opinion, the best way to release it because you're actually getting into the muscle itself, whereas all those other methods were just on the surface of the muscle itself. So what other questions do you have with that?
No, I love it so much. So, I mean, I'll just point out my experience with dry needling because I I actually had my PT record it so that I could post it once, and he's like, "You're so weird," but okay, sounds good. And so he recorded himself putting the needles in, and I'll say, like, not all the needles hurt. The only time that they really hurt is when they get right into that big trigger point. And I'll say, like, it's like a weird spasm. It's like you already have all of this, and you can attest, like you already have this big, trigger point here that's a knot and it hurts. And they stick the needle right in there and it almost like re-spasms. And then he's like, "Oh, I know I got it then because the muscle jumps, right?" And then but I don't want people to be scared of it because it may be uncomfortable for the first few seconds, but then after they turn, do you do the electricity pieces through it too?
I don't as often, but I
Okay.
can.
Yeah, he did it with mine because I think it was so severe for so long. But then it's almost just like a tensiometer, but it's like a deep probe tensiometer instead of just on the skin level surface. So I want people to like not be afraid of it because if your PT suggests it and says it's the best option for you, I don't need to shy it away just because it is needles. Uh, they're clearly trained to do it, and as long as it's a clean environment, which I'd hope that's the PT place you're choosing to go, um, it should be fine and it can be so effective. I know the second that he would pull those out, like I would have massive relief. So I don't know if you have anything to
Yeah.
add to it, but I just think that that's something to point out. Like the cupping doesn't hurt at all. Scraping can be uncomfortable. The needles maybe hurt for just a few seconds, but I don't know. Do you have anything to add?
I would say, I mean, so there's a couple of scenarios. Like if someone is absolutely terrified of needles, like it's not the right treatment for them. And you probably don't have a lot of teen boys who watch that, but that's the population is teen boys. They're terrified of needles. They're all terrified of needles. So not a good clientele base. But if you're like, I don't like needles. I don't like needles. I hate having my blood drawn, but I love dry needling. And if I had someone who could do it to me every week, I would. And so it's not so much like you don't necessarily feel the needle like when it goes in, and you
Mhm.
may not even feel it when it's in a muscle if we're not necessarily getting the trigger point. What you shouldn't feel with dry needling is like stinging. You shouldn't feel sparkly. That's what I say when like we're near a nerve. Most of the time, like both of those, like there's no like it's not a contraindication. When it's stingy, it means we're near a surface capillary. There's nothing that we can do about that. We just move the needle, right? So it's not going to cause harm to the patient. And then if it's sparkly, same thing. Your nerves are really resilient. Your nerves will be totally fine. We just need to move the needle. Like that's all it is. What people usually feel like you experienced, Nikki, was like the twitch. But then also sometimes people don't experience the twitch and they experience what I indicate as like a deep ache. And that deep ache is like the only thing that I can equate it to is like you stubbed your toe,
Hmm.
right? So like you're gonna feel it and it's like, oh, like that is such a deep ache. But just like you said, like within a couple of seconds, it's going to go away. Now, will there be soreness afterwards? Probably, because we just released a bunch of lactic acid. And so that's what I love to tell people is like, man, we had that needle in you for 10 seconds. You just had the best workout of your life in that 10 seconds because they're going to be like they can be really sore in that area.
Yeah, absolutely. And that's something I forgot to mention too. So I'm glad that you like brought that up because if people leave PT after doing dry needling for the first time and they have all this extra soreness, it makes sense because that lactic acid releases. That's so much sense. And for anybody who's not super well versed, the lactic acid buildup in your muscles while you're working out is what makes you not be able to do that next rep as well. Like that's that burn essentially. So it's just helpful to understand like that's a natural occurrence in your body. That's why it's there. It goes to something that's tense, and that's why there's so much buildup of it. So when it releases and there's like this big release in one small area, you're going to have soreness there. Like you just worked the hell out of that muscle. So that just brought it full circle. So I'm so glad that you said that. The last question that I really had, which is kind of random, but I know that you work in a CrossFit gym right now, but you've been seeing patients for 11 years. So do you find that there is more clients, like our active clients, right, that are from doing one sport or type of like workout than another? Like, is it CrossFit? Is it strength training? Is it running? Or do you kind of see a wide array from everywhere?
It's a wide array from everywhere.
Okay.
Um, but I think, I like to kind of dive further into this. What I would say is like what where you're going to see deficits is when people are really pigeonholed into doing specific exercises and don't get beyond it. So like let's say for example you're a runner. Well, are you doing any cross training? Are you doing weightlifting? Are you doing lateral movements? Or are you just running forward in a straight line, right?
Yeah.
And we see that like I saw that a lot in my practice. So that's what I would say is a lot of times when we get like one sport specific or I'm gung ho on CrossFit or whatever, right? Like it might be because there are some deficiencies in cross training.
Okay. Yeah, no, that makes total sense. Like if you're only ever working one set of muscles, you're going to probably have soreness that's very specific to that because you're not ever working the opposite sets. Makes absolute sense. I love
Hmm.
that. So I just kind of wanted to ask that question because I feel like so many people like blame injury on like CrossFit, right? So that's why they won't go there because you do some crazy stuff at CrossFit, right? But I will say that when I was doing CrossFit and it was legit like WODs and strength all the time, I really wasn't injured very often. If you do it right, you're not going to get injured just because you're doing one sport or another. But I also don't want you to feel like if you have like this aching pain or some sort of discomfort, go to a PT regardless of what you're doing, even if it's just from going for walks. If you're new to going for walks and you're getting these weird achy pains or something, like go to a PT and get it checked out because if you let things fester, they get worse. So I don't want anybody to count themselves
Right.
out just because they're not doing something that's deemed super hard, you know?
Right. Well, and I would even say too, in that sense, Nikki, of like, don't you don't have to wait to go to a PT just when you have pain, right? We're not pain therapists, we're movement therapists.
Yeah.
And so, like, if someone has a deficit in flexibility or range of motion, like, let's say you are like, we don't even have, I mean, and we'll go CrossFit. Like, let's say you're learning how to do overhead snatches and you don't have the shoulder mobility and you just can't get it, but it's not painful. You just don't have it. That's a
Hmm.
perfect time to go to a physical therapist, right? If
Yeah.
you're noticing like, man, I really want to get into like burn boot camp and, but they don't have, bars where I can hold on to do a squat and I just can't do the squat. It doesn't cause me pain. I just don't have the mobility, man, go to a PT, right? And that's what I would say is like, a lot of times we just wait until we have that pain. And I think that unfortunately, I think is society's mindset of instead of preventative, we're doing reactive healthcare. And so that's what I would
Yes.
just encourage people is like, hey, let's do preventative.
Guilty as charged. I didn't even think about it from that angle because that's right. Like it makes so much sense. I'm so glad you said that. Such a good way to bring this kind of full circle. I guess one of the last things that I love to ask people on my podcast is, and I know we're talking about physical therapy, but this can be from any angle. For anybody that's out there struggling right now? Because I know that you've been through your own weight loss journey, you've been through all kinds of different things. Um, if anybody's out there struggling, what is your best advice to help them get through the day or make things a little bit better?
Um, Man, well, we better start another podcast on that. Um,
Which we
I would
will.
say, I mean, really for me, yeah, I mean, really for me, like at the end of the day, what has really helped me is my faith. And so that's what I would say is like, we have to dive into not just the physical side of things, but emotional, mental, spiritual. And so, whatever that might be for you personally, right? You've got to take that time because we can, and you, like Nikki, you know this, and I'm sure you've talked about it. Like, we can fix things physically, but if we don't address things emotionally, mentally, spiritually, like it's not going to stick.
Yeah. Yeah.
So,
Oh, I love that. I love that. And you guys, I'm going to put Leslie's information in the comments for her Instagram and all of her stuff there so you can follow her and ask her questions and stuff. I will say that every single day, if you watch her stories, she will always remind you to look up. So please go check out her stories because I watch them every day just for that reminder to put my phone down and look at where I'm at. So, a wonderful person to follow, wonderful person to get to know. And thank you so much for taking the time to be here. I know that people are going to have some great takeaways from this.
absolutely. Thank you so much.
Have a great day, Leslie.
You too, friend.
Bye.